Good afternoon, everybody, and welcome to this afternoon's webinar. We have loads of you joining and more joining as I speak, which is absolutely wonderful. And we've got a great mix of people from the healthcare profession, GPs, nurses, public health professionals, communications experts. So you are very welcome at this afternoon's webinar. I'm Doug Brown, I'm Chief Executive of the British Society for Immunology and delighted to host this afternoon's session. So the session today, we have two amazing guests who I will introduce very soon, who are doing a huge amount of work engaging with the general public and others around COVID-19. So they're going to tell us a bit about their work, and then we're going to put some questions to them. So that'll be questions from you as our viewers. So please do get your questions in. We have a chat function within the webinar platform, so please do put your questions in there. A couple of members of my team are working through those questions, and I will be sent them by WhatsApp and ask as many of those questions as possible of our guests. The other thing I just wanted to highlight before we come to introducing our guests is one of the resources that we have here at the British Society for Immunology, and some of you may have seen this before. We have this COVID vaccine guide. It's updated constantly as and when new information comes out. In fact, it was just updated in the last couple of days with the new information about the new dosing schedule. So please do, if you've not seen it or not seen it for a while, do go to the link here. We're going to put the link in the chat function as well, because it will hopefully be helpful for you in your everyday work. So coming back to this afternoon's session, as I say, I'll introduce the speakers. There won't be any formal presentations. They're just going to casually talk about the work they've been doing and answer your questions. So do get those questions in. So without further ado, I would like to introduce our first guest, who is Dr. Vicky Mail. And Vicky is a reproductive immunologist at Imperial College London. She's been, over the last few months, monitoring all of the data coming out and all of the research that's been ongoing into the safety of the COVID-19 vaccines in pregnancy and around issues to do with fertility. She's very active on social media. Some of you have probably seen the work that she's been doing, answering questions from the public and others. And as a BSI member, she has been supporting some work that we've been delivering through the London Borough of Bexley, where we've been training health and social care workers around vaccine issues and around the COVID-19 vaccine, to improve their confidence in having conversations with people in their community about why it's so important to receive the vaccine. And very recently, in fact, featured on BBC Radio 4's Women's Hour as well. So she is very famous as well as very amazing. So Vicky, if you could reveal yourself, that would be incredible. And when you are here, I will hand over to you. There you are. Hand over to you to tell us about your work, if I can, please.
Hi everyone. Nice to be here. So the reason that the BSI has asked me to come and talk to you today is not sadly because I'm completely down with the young people. I think you've got Bernard for that, who'll be speaking next, but because I do a lot of work around a particular area that worries a lot of young people. And actually a lot of people who are not so young. And so I have quite a lot of experience about speaking about the evidence in this area. And this area is, will the COVID vaccine have any impact on my fertility? And the way that I got into this, which also gives you a little bit of a background as to where this idea came from, was because back in December, someone called Michael Yeadon, who about a decade ago used to work for Pfizer, but has since then been retired, he said that he thought that the antibodies that the COVID vaccine would raise against spike protein might cross-react or stick to some proteins that are on the placenta called syncytin, and that this might be bad for the placenta and it would therefore be bad for fertility and pregnancy. And actually, he never said that he thought it was going to be a permanently sterilizing thing. He thought there might be a sort of short-term reduction in fertility. But nevertheless, this kind of idea, which even at the time we thought was very unlikely, kind of took off. And at the time, the reason we thought it was unlikely was because if antibodies against the spike protein of COVID-19 did cause any problems with fertility, then they would also cause problems with fertility in people who'd had COVID-19 infection, which we actually don't see. So the reason I got into this was because basically he was talking directly to my own research area. And I thought, well, if someone who works on the immune system in the lining of the uterus and how it recognizes the placenta, which is my research area, isn't going to say, well, this doesn't seem very likely, who's going to say that? So kind of December, I wrote a thread on Twitter that said that. And that's how I got into this whole area. But what's quite interesting as I've talked to people more and more about this is that now most people don't seem to know that that's where that idea came from. So there's very little point most of the time when I'm talking to people saying, oh, we know that those claims that were made in December are actually false, because most people aren't even thinking about the claims that were made in December. What people want to know is, well, I don't care what the mechanism is there any evidence that there's going to be a problem with the COVID-19 vaccine and my fertility? And there are 3 lines of evidence that I normally point people to when we're discussing this. The first is that actually in the clinical trials, even though people were asked to use reliable contraception, because people were not supposed to be either pregnant or becoming pregnant in the clinical trials, nonetheless, across Pfizer, Moderna and AstraZeneca, which we're using in the UK, 57 people became pregnant by accident. And those pregnancies happened equally in the vaccinated and in the unvaccinated groups. So that, even from very early on, told us that it didn't look like the vaccine was stopping anyone from becoming pregnant. As the vaccine has been released into more general use, we're actually getting more evidence around this. So now there are actually a number of studies focusing on women here for the moment. There are actually a number of studies in IVF clinics where they've looked at how well people do at becoming pregnant via IVF if they've been vaccinated compared to if they haven't been vaccinated. And the reason that these are good is because obviously we have an unvaccinated control group and we know that everyone's trying equally hard to become pregnant. And in those cases, again, if you're vaccinated, you're no less likely to become pregnant than if you're unvaccinated. And they've even done studies where they've looked at people who had IVF before they were vaccinated, like a year ago, or more than a year ago, and after they were vaccinated, and looked at that. So the people act for their own control groups. And again, vaccination doesn't reduce your chances of becoming pregnant. Finally, in the USA, since at the end of March, 4,804 post-vaccination pregnancies have been reported to the CDC. That's actually going to be an underestimate because it's only people in America and it's only people who knew that they could report their pregnancies to the CDC, and it's only those pregnancies that happened before March. But nonetheless, you know, we've got thousands of post-vaccination pregnancies on the books. To talk briefly about men, who I sometimes forget about because I work on female fertility, we also have studies of sperm before and after COVID vaccination, showing that COVID vaccination doesn't harm the quality of sperm. But for men who are worried about fertility, it is actually worth also mentioning that COVID itself does seem to negatively impact the quality of sperm. And we hope that this isn't a long-term thing, but we don't know yet. So it's worth mentioning that. Then the other thing I've been talking about more and more recently is the effect of COVID vaccines on the menstrual cycle. Because as the vaccines have been rolled out to more and more people who are, you know, at that age where they're still having periods, more and more people are saying, oh, you know, I had the COVID vaccine and I then had a very heavy period the next month, or my period was a little bit late or something. And actually, these are the 2 most common sort of experiences people have, a very heavy period or a late period. And there are 2 reasons that people are worried about that. First is obviously, you know, if you're going to have a surprise really heavy period, you don't want that to be happening while you're sitting on your mother-in-law's cream silk sofa. So it's quite useful to know if that's a real side effect that we should be telling people about. And we don't know that yet, actually. And then the other reason that people are concerned is because they think, well, if it could change my period, could it potentially affect my fertility? And we've already talked about the reasons that we think the COVID vaccine doesn't affect fertility. But the other thing that I mentioned when we specifically talk about this is that we do have 2 vaccines that we have some evidence that they have effects, short-term effects on the menstrual cycle, similar to the short-term effects that people are reporting on here. And those are the HPV vaccine, for which the evidence is pretty good, and the flu vaccine, for which the evidence is less good. and both of them seem to have short-term effects on the menstrual cycle, but both of them we have really, really strong evidence that they don't actually harm fertility. In fact, the HPV vaccine improves fertility by stopping you from getting cervical cancer, which obviously is bad for pregnancy. So these are the areas that I'm most often talking about when I'm talking to people who are concerned about sort of the COVID-19 vaccine and fertility. As Doug mentioned, I also do quite a lot of work talking to people about the safety of COVID vaccination in pregnancy. I won't talk to you about that right now because I don't know if the young people are so worried about that, but we can maybe cover that in the Q&A. And the final thing I want to say is that one of the things that I do is I maintain a document which kind of describes and links to all the studies in this area so that people can look at them themselves if they would find that useful. And I think we're going to be able to drop the link to that into the webinar's chat so that people will be able to access it if they would like to. And so with that, I'm going to hand on to the next speaker who can tell you a little bit about her experiences of talking to young people about this.
Fantastic. Well, thank you very much, Vicky. A great overview. And again, everybody get your questions in. Vicky will answer as many as she can. Vicky, I'm trying to not take it personally that you say you often forget about men. It's very important that you don't, of course. But we'll come back to you in a second, Vicky, and I'm sure there'll be lots of questions. But before then, I'd like to introduce our second guest, who is Dr. Pinar Talabani. And if Pinar could join us on screen, that would be amazing. So Pinar is a clinical academic trainee, which is a doctor doing a PhD in immunology in Cardiff University. She is an active member of Muslim Doctors Cymru, and through that is delivering a number of different public engagement events within the Muslim community in Wales. And I believe just yesterday did a webinar with the Welsh Government Minister for Health and Social Services, which is fantastic. So reaching the dizzy heights of the Welsh Government, which is amazing. And Pinar is also an active member of an initiative called #Team Halo, where there's lots of engagement activities being delivered through Team Halo on social media, and not just across Wales. This goes wider than that, of course, and they're engaging and answering questions about COVID and about COVID-19 vaccination, in particular focusing on the social media platforms that younger people use. And I know this because my 12-year-old daughter tells me Instagram and TikTok are where it's at. So I believe that's where Team Halo are focusing on mobile. I'm sure we'll hear a lot about this in the next few minutes. So Pinar, over to you. Do you want to tell us about your important work?
Thank you very much for that lovely introduction, and thank you, Vicky, for calling me down with the youth. I've never been described as that, but I will wear it as a badge of honor because I love that. Thank you very much for inviting me to speak today. It's a real pleasure to be here, and I don't consider myself a public engagement expert by any means, but I'm happy to share what I've been doing over the past few months and what I've learned along the way. So in January, a group of us got together and realized that there was a lot of hesitancy among our own community about the COVID vaccine. And when the vaccines were approved for use in December, there was a real polarization to some people being very pro-vaccine, being excited to have their vaccine. I was definitely in that camp. And others being very hesitant and very worried that we'd managed to get a vaccine so quickly. So we got together and created Muslim Doctors Cymru with the sole purpose of trying to reassure our own community about COVID vaccines, but very quickly realized that because of low uptake within BAME communities as a whole, that we needed to try and reach out to more communities. And so we did our best to do so. And we did that by engaging in and organizing and delivering multiple webinars. I've lost count of how many webinars we've done, but I know that we've done them in multiple languages, so at least 6 languages. And having people in your own community who speak your own language, who you may have grown up with if you're from this area. I mean, I'm not, but a lot of my colleagues are. Explain the science and the evidence behind the vaccines and reassure that they're safe carries a different kind of weight to just some random person on TV saying that they're safe. We also engaged community figures and faith leaders and had that dialogue with them. And it was important to have non-medics on our panels because they could really hold us to account if we were using jargon, and they could also bring their concerns they'd heard amongst their own community about the COVID vaccines. So that live Q&A webinar was really aimed at kind of the older groups when we first started the COVID vaccine rollout, and we had really good feedback from it. We also realized that there was a lot of misinformation being spread on social media, so it made sense that we use social media to spread accurate information in different languages again. And with people from faith groups, community leaders, again, having dialogue with us, but also us creating short videos called our COVID Mythbuster series to, in 1 minute, explain why the vaccines don't cause infertility, for example. And I'm a huge fan of Vicky because I've been using a lot of your resources to create those. Thank you very much, making my life a lot easier. So then that was social media. And then I think as we kind of went down the age groups, we realized that the approach that we had to kind of the older age groups would not really carry and would not really work with younger people. So that's when I decided to join Team Halo and take to TikTok and Instagram. And I'm not tech savvy, so it was a steep learning curve. But I think TikTok is a great platform because it's very user friendly. We can create short, punchy videos, make it fun, and really try and get that vaccine confidence out in a way that's engaging to younger people. But I think the thing that we've kind of learned, or I've learned along the way, is that there are people who are very much fearful of being judged if they do express concern and hesitancy. And I think it's important to make information available at people's fingertips on social media, on GP websites, as I know has been the case already, and and on other resources in place where people can go and look things up and know that it's evidence-based, accurate information. But I think the other side of that is also reassuring people, regardless of your background, your training, your specialty, your profession, that it's okay to be concerned and it's okay to be hesitant, because there is so much misinformation out there, and it's everywhere. And what you'll notice is that anti-vaxxers will use scientific terminology. They'll use it incorrectly, but they'll use scientific terminology. And it's very hard to be able to tell the difference between evidence-based, accurate scientific information, the difference between that and the nonsense that's being spread. So I think reassuring people that it's okay to be hesitant and concerned is really key to keeping that dialogue open so that we can continue to, as a profession, make ourselves available to be able to reassure people. And I just want to also thank the BSI for the infographics that you've made, because we've been using a lot of it on our social media pages, and it's made our life a lot easier. So I'm going to stop there, and I'd be happy to answer any questions and address specific concerns if I can.
And I'm sure you can. Thank you, Benar. That's fantastic. And I'm sure everyone who is watching now will agree with me. I mean, what a pair of inspiring individuals, taking it upon yourself to engage with the public through social media and other means as well. I mean, I for one am inspired by the work that you both do. So thank you very much for that. But now it's time for questions, and we've got some questions coming through from the viewers. So thank you, but please do keep them coming in. We've got questions for about the next 35-40 minutes, so plenty of time to answer as many questions as we can. So the first question that I wanted to put to both of you, actually, and I wonder, Benar, and you, because you touched on this, whether you could cover this one off first, which is about adapting your communication style when talking to younger adults. You're saying that the methods and the communication and the messages you're using for older people, which I'm sure I would fall into that category, very different to how you want to engage with younger people. So what are those differences, and how did you change that?
So from my experience, I think social media really is key here, because young people will get their information from their friends and from social media rather than make a GP appointment and ask questions. And I think because there's so much misinformation on social media, it's equally important that we flood social media with accurate information, but in a way that's quite fun. Now, I'm not tech savvy. I don't know how the TikTok algorithm works, but sometimes I'll spend ages creating a video and it gets a couple of hundred views, and I'll quickly make something just in my kind of spare time and it will get 10K views. And I still haven't figured out what or how that happened. But I think keeping the message short, punchy, and using infographics is probably the best way to engage young people, but then also to keep the dialogue open of, if you have any questions, please reach out. This is what I'm here for. And then encourage that dialogue that way.
I mean, I'm intrigued. What's the most fun you had with a TikTok post that got a lot of hits?
So there was a song that went that became viral. A couple of things, actually. The first one was just me talking like this about how we know that long-term side effects aren't an issue, that if you have the vaccine, your side effects will always present within a few weeks, and explaining the science behind that. That's done very well, surprisingly, but I released that weeks and weeks ago. The more recent one that I released was just me at the beach with the sea coming in and out, with the waves coming in and out, but some music, and you have to choose between having COVID vaccine and hospitalization, and then long COVID and COVID vaccine, and it's kind of the choices and putting it into context, but also putting in the social disruption, the economic impact that COVID has had, and not forgetting about the non-health impact of COVID, because actually when it comes to young people, that's going to be the one that they will have suffered from the most.
Definitely. No, that's fantastic. Thank you, Bernard. And Vicky, how have you modified your way of engaging with people over the months as the vaccine program has moved on?
I have modified my way of engaging with people a lot, and I think that what Bernard says about, you know, making space for people to come to you with your genuine concerns is with their genuine concerns is probably really the most important thing. And for me, in terms of speaking to young people, I mean, I know I guess you've got a lot of healthcare workers here, so it's slightly different, isn't it? Because I don't necessarily try to get down and have the fun with the young people, because part of why people ask me questions is because they're looking for someone who they perceive as having some level of expertise, of being a trusted voice. So I don't want to lose that. But I do try to talk to people in quite a natural way, kind of like what I'm talking to you today. And, you know, in fact, I still have that I've tried to train myself out of, you know, my young person speaking habits that I had to lose when I became an old person. So sometimes I do slip back into those a little bit. An old person, yeah, here's me with my blue rings. But the other thing that I do actually is, if I really, really want to kind of engage with young people in the way that Bernard's talking about, I did get involved with Team Halo actually, but I am not a face. I, provide the information, and there are quite a lot of people that when I see their videos, I'm like, oh, that's you saying my information, and I'm pleased to help in that way. And then I'm also collaborating with a couple of YouTubers who are putting out like such cool, casual stuff that's way more sweary than I could ever get away with. But I'm fact checking it, and I'm making sure that it's all good science. And that's one way of reaching out, you know, of kind of just being quite casual and fun.
Yeah, way more sweary. I might have to get myself a TikTok account then. That'd be great. Thank you, Vicky. So sticking with that, the kind of theme of how to communicate, because we've got some great questions coming in from the audience, but some specifics, and we'll come to those in a second. But Vicky, do you want to kick us off with what your approach is to how to best counter misinformation that's coming through? So as you picked up in your opener, there is misinformation out there, but it is sometimes quite tricky to address it head on. What's the approach that you've taken that seems to have worked? And Bernard, I'll come to you with that question afterwards as well.
So kind of unlike Bernard, you know, I'm not usually in a broadcast kind of a situation. I'm mostly, when I'm on social media, I'm on Twitter, which means I'm having a conversation. And that gives you space to start off by saying like, oh, what's the reason that you think that might be a problem? And that's important for two reasons. First of all, you know, it gives you an idea of if there's some specific thing that a person's heard that they want, you know, maybe some proper information on. Or maybe there's just a general sense of unease, and kind of knowing exactly what it is that someone's worried about helps you a lot to address what it is. And then the other really important thing, and I think this is particularly important for young people actually, is that a lot of people are used to not feeling as if they're being taken seriously by, you know, doctors and scientists and, you know, people like me. And for those people, just having that question, it's like, okay, you know, tell me what it is that's worrying you, straight away, it puts them into a sense of, okay, here's someone who actually wants to know what I think. And I had a really amazing conversation with someone on Twitter over the weekend, actually, that I'm really glad I had, because this person was just like lobbing so much nonsense at me, so much misinformation. And I was like, oh, this guy, he's just so determined to waste my time. But he was so determined that, like, if ever I tried to ignore him, he would be like, you haven't got back to my point, get back to my point. And I was getting back to his point, but, you know, doing it by listening to him and having a thing. And then this morning I woke up to a message that said, I'm really glad that you've like taken the time to have this chat with me, because I was really falling for some of this stuff that I've been seeing over the weekend, and you having this chat with me has actually made me realize that it's probably not right. And I so nearly just ignored that guy because I thought he was basically just making trouble. And it turns out he wasn't making trouble. He needed someone to listen to him. So I think that's so important.
Oh, that's brilliant. And I mean, that's real world example of the impact that you're having, but there'll be many other people that you're not engaging with directly that you don't know the impact that you're both having in a positive way on their lives, which is fantastic. Thank you, Vicky. And Bernard, so what approach have you taken around tackling misinformation and trying to talk people around or engage with them in a way that they can reach the conclusions they need to be reaching?
So I just want to echo everything that Vicky has said, because I think saying what's worrying you really helps people to feel like they're being heard. You know, tell me what's worrying you, explain it to me, and let's have a chat. And then it just opens it up to, oh, okay, she's not going to just come out with, no, it's this or it's that. It's that she's listening to what I'm actually saying. So I commented underneath a picture of Holly Willoughby having her vaccine on Instagram. And it was when I had just joined TikTok and I started releasing some videos. And the comments underneath, why are you doing this? It's experimental, you're going to die within 2 years, all the stuff that you normally, you know, that you get thrown at you from the anti-vaxxer community. And I commented and I said, I'm a doctor and scientist. I understand the evidence behind these vaccines. I've had both doses. I didn't hesitate 1 second. I'm happy to answer questions. And I was met by a barrage of abuse. They then followed me to my Instagram account and my TikTok videos. And so the anti-vaxxer community found me, basically. But among all of that, I also had a couple of people reach out to me by messaging me on Instagram saying, I'm worried because I've heard about this. So then via a combination of voice notes and TikTok videos that I made in response to what they were saying, we were having a conversation on the Instagram messaging pages, explaining, first of all, really trying to understand what was worrying them, and then trying to address each and every point. And over the space of, I'd say, 2.5 weeks, I've taken someone, I don't think it's just me actually, because I've used I've used your resource, Vicky, I've used resources from other TikTok creators, but having those at my fingertip has meant that I haven't had to go back and recreate everything myself, but I've known where to go for them. And through a combination of that and voice notes, this person has gone from being very much anti-vaxxer, self-proclaimed anti-vaxxer, to now a little bit worried, but is going to consider having the vaccine. And at that stage, then there was this nonsense coming out about how the vaccines make you magnetic. So it's back to square one, because she's like, I tested it on my parents, they've had their vaccines and now metal sticking to their arm, and oh my gosh, this is terrible. And so it was, okay, do not lose your cool over this, because I was this close to be like, not again. And I just went back to the same approach of explaining how it's not true, using other people's TikTok videos, explaining what that actually means. And we're now in a situation where she's booked her vaccine. And this has happened with a few people. And I've never met this person in all my life. I don't know what she looks like. I don't know where she lives. But I, having exposed myself on social media and made my pages public, she knows a lot more about me than I know about her. So I think it's that dialogue and it's that patience. And I don't always have that patience. I don't claim to. Sometimes I just block them because it's just too much hassle. Because they are, you know, it's when they cross the line of hurling abuse and then threatening you with hanging at the Nuremberg trials, which I've also had on TikTok. But the ones who are bringing genuine concerns, and even if they are doing it in a slightly abusive way, but it's genuine concerns about the vaccines and not me as an individual, I'll always try and engage and then hope for the best.
That's great. I mean, the inspiring stories keep coming. Thank you both. That's amazing. And Bernard, we've had a question coming in from the audience, and be good to get your thoughts. It kind of follows on from this one, which is there's a whole heap of statistics coming out and facts that are coming out from the research studies that are happening and our understanding around the vaccine. How can the audience, and if you can give us some tips, how can we best present those statistics and facts in a way that interest and engage and are accessible to a younger adult audience?
So I think this is a good example of where places like TikTok will be, because in a minute long video you can present infographics behind you. So there's a green screen option behind you, and you can point to the bits and explain them. You can do Q&A dialogue, so you can pretend to be someone else and then they're asking questions and vice versa. But I think ultimately figuring out what person's concerned about and then being able to present the evidence. So a really good example is what Vicky said about male fertility. Well, we've had studies on male sperm count, and no, it doesn't, the vaccines don't impact it, but then always bring it back to COVID, because actually COVID, there is evidence that it causes erectile dysfunction in men, and we don't know what impact that's going to have long term, but that could be a long term thing. So I think that's it, and it's always putting things into context. And it's the same thing about the clots. You know, we saw the clots emerging as a possible risk with the AstraZeneca vaccine. Initially, we just all we could do in terms of the data was put it into context of clots are common in the population. They're caused by smoking, by the pill, by obesity. And then trying to put it into context of the numbers of the COVID vaccine. Somebody yesterday in this webinar that I was in put it into the context of this. Dying from the clot following the AstraZeneca COVID vaccine is on par in terms of statistics with an aeroplane crashing into your living room and killing you that way. That's how rare it is. And I think context is really important here.
Definitely. And because there's lots coming out, and there will still continue to be lots coming out, and as we move through possibly booster programs and future years, maybe future pandemics, you know, these are all tips and ways of communication that we need to absolutely be capturing. There's, by the way, both, there's a lot of love coming in for the work that you've been doing. Vicky, some thank yous coming in around your Google Docs resource. People have used it and found it fantastic, so thank you for that. And the team have pasted a link into the chat, so if people could, if you're interested, do have a click on that. Bernard, lots of love for your videos as well, the myth busting videos, and the team have just shared the link to those videos as well. So again, viewers, please do have a click. Lots of really cool information in there that I'm sure will be very helpful indeed. So coming back to some of the questions that are coming in, so we've got some questions around, and Vicky, you touched on this, around the longer term effects of vaccines. So we know they've been in trial and we've been following people, and there have been other research studies and we're following those. But you know, these vaccines have only been around in the wider population for 6-7 months. So how can we explain and respond to people's concerns about, well, what could this vaccine do to me in 5 years' time, for example?
So before I even start on that, what I usually like to maybe remind people, but quite often tell people, is that the mRNA vaccine platforms, which of course the main ones that young people are going to be using, they were first trialed in 2006. So if what you're specifically worried about is the vaccine platform, we actually have kind of like, what, 15 years of follow-up on the very first people to have these kinds of vaccines. But yes, it's completely fair. Sometimes I say that to people and they're like, well, yes, that's fair. But, you know, this actual vaccine was first used on people, humans, kind of a bit more than a year ago in the context of the clinical trials, and then widely about 7 months ago. So how do we know what's going to happen in the future? And this is one of the reasons that people often worry about fertility, because actually it's not so much that fertility is like you're fertile, and then suddenly, boom, you're not. It's more that you don't know if you're fertile until you start trying to have a baby. So it's kind of like you either were fertile or you weren't all along, and then you find out what your status was. And this is quite helpful talking about fertility, because when people realize this, then I can start to say, well, the fact that lots of people are fertile right now, straight after having the vaccine, tells us that even if you aren't right now, straight after trying to have having the vaccine, trying to have a baby, you, like these other people who tried to have a baby, will, you know, assuming everything else is normal with you, which of course it isn't for everyone, that's part of why I do my job, you will be able to have a baby. But then we go to these things that sort of Bernard already touched on, which is, how does the immune system work? This really kind of basic thing. And I usually actually do even get into the level of kind of like the innate and the adaptive immune system. So the innate immune system, it's, you know, it's quick off the blocks, but it's not specific. And kind of the innate immune system is going to get fired up sort of, you know, pretty much the minute that vaccine goes into you. So anyone who has a side effect to do with the innate immune system is really going to see it kind of like that day, maybe the day after, you know. So this is your sore arms, your fevers. If you're really unlucky, this is your having an anaphylactic shock reaction, although that is very rare. So we see some side effects then. And then the innate immune system will tell the adaptive immune system to make a response. And this is when we get this longer, more specific response, which is the point of the vaccine, right? Because what we want is to be protected in the future if we ever meet actual COVID. And how long does this take? Well, almost everyone actually remembers that really famous graph from Pfizer, where they showed that protection started to kick in 10 days after the vaccine. And so that gives people a really good way of hanging on to that kind of like the adaptive immune system starts off 10 days, kind of 10 days after the vaccine. And anything we see that's bad that's going on with the adaptive immune system, or good, protection, or a bad side effect, will happen kind of 10 to 21. We maybe sometimes push it out to kind of 25 days after the vaccine. So an example of a side effect that's mediated by the adaptive immune system is this clotting side effect, which we tend to see between 10 and 21 days after the vaccine. And actually, you know, the immune response, it doesn't get stronger over time. For a really good vaccine, it maybe stays the same and you don't need a booster. For most vaccines, it doesn't stay the same, it gets weaker and you do need a booster. So over time, anything that hasn't happened to you kind of within 21 days is not suddenly going to happen to you after 21 days. If anything, you know, anything that happens will fade away after 21 days. And a lot of people just haven't really thought about it like this before. And I think that people find it quite helpful really to think through the kinetics, although we don't necessarily call it that when we're talking to them, but the kinetics of the immune response, because that tells us that, you know, we're not going to see something that suddenly appears 5 years down the line. It's not really how the immune response works.
Yeah, that's really helpful. I mean, it's a tricky question to answer, isn't it? And a tricky concern to address. But
yeah, because we can't use evidence for that one, can we? Without it, absent a time machine, we can't, you know, say like the studies have been done, because they haven't yet. So we really have to reason from what we know about the immune response. And also, I talk about other vaccines. I think people sometimes find that helpful, particularly people who. So I talk a lot to people who are pregnant who are deciding whether they're going to get the vaccine. And actually, a lot of them, when I say like, well, did you get, you know, whooping cough? Did you get flu? Like, oh yeah, well I did. It's like, well, we know those don't do anything bad, and we actually have good evidence that COVID vaccines don't do anything bad in pregnancy either. But you know, that just gives people a bit of extra reassurance when they're asking questions like, okay, it doesn't do anything bad right now, but what if something happens to my baby in like 5 years' time? So that's kind of when we'll bring it back to some other vaccines that are very well characterized.
Definitely. And sticking with you, Vicky, on the pregnancy side. So you mentioned in your open, you're happy to elaborate on that and the evidence that there is there around any effects during pregnancy. We have had a question coming in asking you to elaborate on that. So could you perhaps speak a little bit about some of that evidence and any impact, if any at all, on pregnancy through vaccination?
Sure. So this is a really good example of something that Bernard mentioned earlier, which is a lot of the time we do also need to bring it back to COVID. So when we're asking, you know, I'm pregnant, should I be getting the vaccine? The first thing that I think it's worth saying is like, if you're pregnant, what will happen if you get COVID? And to not scare anyone, you know, most people who get COVID when they're pregnant are fine and their baby is fine, but it does roughly double your chance of having a baby that's born preterm. It does roughly double your chance of having a stillborn baby. It much more than doubles your chance of all kinds of other things that aren't quite as long-term terrible as that, like, you know, you go into an intensive care, your baby goes into an intensive care, but we want to avoid those things as well. So that's kind of what might happen if you got COVID. And you can avoid COVID in lots of ways. One of the ways you can avoid it is by kind of like sitting tight in your house if that's what you want to do, but lots of people don't want to do that. So the other option is to get the vaccine. And then people say, okay, well, is the vaccine safe? And, you know, back in January, that was quite a tough question, because the answer was, well, we don't, you know, we expect that it is because of how that it works, but we don't have the evidence to say that for definite. But now, because certain countries like the USA and Israel kind of said COVID in pregnancy is bad enough that we're just going to give people the vaccine because the vaccine is theoretically safe, that gave us loads of evidence about how safe the vaccines are. And the CDC has been amazing at collecting data about this. And basically using that data, we can say that from the first 3 months that they were vaccinating pregnant people, there was no increased risk of miscarriage if you got the vaccine. There was no increased risk of preterm birth. There was no increased risk of congenital abnormalities, small for gestational age, or something else that's bad. One more thing that's briefly slipped my mind. But the paper that you want to look at it's in the New England Journal of Medicine, and it's called something like preliminary findings on the safety of COVID vaccination in pregnant women. And so everything we have says that it's safe. We know that COVID's not safe. And so when I'm talking to people, we mainly kind of focus on those 2 lines of evidence. The other thing that's kind of important, particularly, you know, if some of you are GPs who are counselling people, which I'm not a GP, so I always have to be like, I'm not giving you specific advice, I'm just telling you what the evidence is. You know, some people would feel more comfortable waiting until after 12 weeks. And that's not actually our advice in the UK, and there's no reason to wait till after 12 weeks scientifically, but some people feel more comfortable, and I can understand that. And there, one of the things that I do say is we know that the dangers of COVID when you're pregnant kind of start at about 28 weeks. So if you feel more comfortable waiting, I can see that, but what you want to do is you want, in order to benefit from the vaccine, to benefit from that reduction in preterm birth and stillbirth, you want to be fully vaccinated by the time you're 28 weeks. So however you decide to arrange it, just bear in mind that you want to be done really by 28 weeks. And that's been somewhat tricky in this country because until recently we had this 12-week interdose interval, which meant that kind of if you wanted to wait until after 12 weeks, you really had to be like quite sharp. But now it's a little bit easier.
Brilliant, that's great. And before I come to you, Bernard, with a couple of questions that have come in from the audience, Vicky, briefly on a follow-up question we've had around breastfeeding, any concerns or evidence around that?
So there's been quite a lot of studies. One thing I didn't say, sorry, about pregnancy is that we do know that the antibodies that your body makes will go through the placenta and might give the baby some protection after it's born, similar to what we see in whooping cough and flu and tetanus. And similarly with breastfeeding, the antibodies that your body makes go into your breast milk and might give your baby some protection, similar to the protection that we see with flu in this case. So there haven't been such, you know, detailed safety studies in breastfeeding as in pregnancy, partly because obviously breastfeeding is slightly more light touch as a biological relationship than pregnancy is, because, you know, the baby's not actually inside you. But we have been monitoring through the yellow card and through VAERS and Vigilance, all the different systems for monitoring this, if there's any problem, and none has emerged. And the other thing that's worth saying is for the mRNA vaccines, we do know they don't get into breast milk. So there's really no way we can imagine that it could cause a problem for babies, whereas we do know that the antibodies get into breast milk, and so that might be helpful.
Great, thank you, Vicky. So coming to you, Bernard, we've had some really great questions coming in actually, and a fantastic one that I think you'll be really well placed to answer around how younger people have got some concerns because the guidance and the advice and the rules keeps changing in terms of, well, what vaccine, when, how, and all of that. And so it does kind of lead some of them to believe that, well, actually, do the scientists really know what they're talking about? And is this something I should be putting myself forward to be getting? So, I mean, what are your thoughts on that, and how? I'm sure you've had this question as well. How have you gone about addressing that and trying to allay some of those concerns?
So the first thing to say, I think, is when we conduct clinical trials, we normally include about 2,000 to 3,000 people in phase 3 clinical trials. But the vaccines that are approved for use on the ground and currently being used in the UK have been tested on over 130,000 participants. So already the data is much more robust. But worldwide, we've vaccinated over 1.5 billion people. Now, normally when we're collecting data with a new treatment, it takes us ages to be able to get to those numbers and to pick up rarer side effects takes longer, years and years, to be able to find out what those rarer side effects are. But with these vaccines, because we've rolled them out so quickly across the UK, the US, and the world, we have data from 1.5 billion people. So we've picked up rarer side effects much more quickly. And it's not that your risk is higher of these rarer side effects if you're a certain age group. It's all about risk balance. So balance of risk and benefit. So because you're less likely to end up in hospital and die from COVID being young, it makes sense that we have other vaccines that are available, that are approved for use and are safe, that you're offered an alternative. It's really that simple. And we have the data to back up their safety. So I think it really is that simple.
That's brilliant. And I mean, if there are questions and concerns about, well, you know, shouldn't we wait until we know everything until we start rolling these vaccines out? How again can, you know, in particular the people that are joining the webinar today, how can they reassure those that have questions around vaccination? You know, we don't know everything, but we still want everybody to accept 2 doses of the vaccine. What tips or advice would you give our viewers today?
So I think there are 2 main reasons that we need to think about vaccinating people who are in the younger category. The first is the Delta variant. We're seeing more and more with the new variants that you need both doses to have that good protection, that 1 dose isn't actually enough. And it's going to take time for you to have the first dose and have that gap and then have your second dose. Younger people may not be at higher risk of death and hospitalization, but we have seen young people who are otherwise healthy sadly die and end up in hospital from this virus. And when it comes to things like long COVID, which is causing debilitating fatigue and people struggling to return back to work and irreversible organ damage, we're seeing that more in middle-aged and younger people, to the extent where people, you know, kids can't attend school, universities being disrupted, and just general day-to-day management. And when I say fatigue, I don't mean, you know, a bit of tiredness. I mean having to stop 2-3 times going just up the stairs in the house. So this is all data that we're getting. So there is real benefit in having the vaccine. But why do we need to vaccinate so many people? And that's so that we can achieve something called herd immunity. Because herd immunity is when we've vaccinated enough people in a population that the whole population is deriving immunity from that vaccinated number of people. And what that means is protecting those who are most vulnerable, who for whatever reason, medical reasons, can't have the vaccine, those who've got weaker immune systems and so can't derive the full benefits of the vaccine. But then from also a young person's point of view, doing that means we can start to get back to normal. So we can actually start to travel again and to be able to enjoy uni again and to see family again and do all the things that have been disrupted as a result of this pandemic. The other key thing about herd immunity is when we get to a situation where we have vaccinated enough people that the virus can't spread at the rate that it's been spreading, we also impact on new variants. So we actually reduce the risk of new variants from happening. So we actually guarantee the vaccine working and then not becoming evaded by a new variant by doing our job and getting vaccinated. So I think it's putting it in the context of a whole bigger picture rather than just saying specifically, what about you as an individual? It's giving both sides of the argument.
Definitely.
I'm going to disagree a little bit. Can I disagree a little bit?
Oh, go on. This makes my job more exciting. Go on, Vicky.
So you said, Doug, you know, like we really want everyone to get vaccinated. And like, I definitely think it would be a good thing if everyone got vaccinated. But particularly when I'm talking to people, and I guess maybe my experience in talking to people who are pregnant kind of particularly brought this to the fore for me. I really think that it's quite important that we give people that space to say, like, actually, I think it's a good idea to get vaccinated. I got vaccinated myself. I've, you know, really recommended all my family to do it. But for me personally, I don't want to force it on anyone. You know, it's your choice. And there are quite a lot of people who really feel like it's being pushed on them. Yeah. And I think that those people will respond quite badly if we kind of get into arguments of we want everyone to get vaccinated, we want to achieve herd immunity. So for most people, I do try to focus on the benefits to them, which, as Bernard has explained, actually, even if you're young and are quite unlikely to actually die, you know, there are benefits around not getting long COVID, around, you know, not infecting your immunocompromised nan, around, you know, I think we'll more and more get to times where at the moment, if someone gets COVID, the whole classroom gets shut down. And as more and more people get vaccinated, we'll get to the point where we don't have to shut whole classrooms down. Those are all individual benefits. And certainly the people I've talked to, I think I do better by focusing on those than by saying like, you know, if we all kind of like pull together, we can achieve herd immunity, and then it will be fine for everyone. And since there are individual benefits, I think it is good to focus on those.
Yeah, no, interesting. And Bernard, you've mentioned a couple of times about those non-health impacts that are really important to remember. In fact, probably more important, as you say, to the younger adults. And Bernard, another question for you, and I'll come to you as well, Vicky, on this one. That we've had them in from a couple of registered immunisers. So fantastic work that you're doing. You're out there. You're actually giving people vaccinations. And a lot of questions they're getting now with where the programme is at is, well, you know, why do we need a second dose of this vaccine? Is it safe? Aren't I already protected? Is it needed? So, I mean, Bernard, how have you answered this question of people? And are there any kind of strategies to approach this, or any resources that might be available to help people on the call?
So I've made a couple of TikTok videos about this because it's very, very topical. The question is, if we're vaccinating so many people and it's going so well, why are we still delaying easing of lockdown? Surely that means the vaccines aren't working. No, we've got data that shows very clearly for the Pfizer and for the AstraZeneca that the first dose of the vaccine gives you some protection, but it's really the second dose that gives you really good protection. And we're also seeing in real world data, the people who are catching this Delta variant, this is specifically the Delta variant, which is now the most dominant variant, and it's rising exponentially in the UK and elsewhere in the world. For this Delta variant, the people who are catching it are those who haven't had any vaccination doses or have only had one dose. And in particular, those being hospitalized are those, sadly, are in the categories that had been offered their vaccine but refused to have it. So we've got real world data that the vaccines are working and are protecting people from this Delta variant. And where we're at the moment in terms of vaccination, we still have a sizable proportion of over 50s, and that's the vulnerable category where the guidelines are in terms of cutoff, that haven't had their second dose. And you need to have your second dose and to have a couple of weeks, as Vicky explained, that 10 to 21 days, to be able to build your immunity in a way that's actually going to protect you. And that's why we need a little bit more time.
Absolutely. Thank you, Bernard. And Vicky, what would you say to people who have concerns about having a second dose?
So this is actually, the people who most often talk to me about this are the people who had one dose of AstraZeneca, and since then the guidance has changed so that someone of their age, or people who are pregnant, for example, would now be offered Pfizer. And so really a lot of the question is like, should I actually go ahead and get my second dose of AstraZeneca because the guidance has changed? And actually, this is quite a tough one, I think, because at the moment in this country, the guidance is if you got your first dose of AstraZeneca, even though the guidance has changed for, you know, let's say you're 35 and now a 35-year-old be offered Pfizer, you should get your second dose of AstraZeneca. And that's because we don't feel that there's enough evidence around really the safety, actually, of the mix and match strategy to kind of recommend that for people. But one, there are clinical trials on that. And two, in other countries, they've just kind of like gone ahead and had a go at that. So I think very soon, you know, it may be that the guidance changes. But for the time being, you know, people say, oh, should I get second dose of Pfizer? Actually, the answer is you wouldn't be allowed to. If you went to a vaccination centre and said, I'd have first dose of AstraZeneca, can I now have Pfizer? They'd say, no, that's against the guidance. So really, for those people, the question is, should you get the second dose of AstraZeneca or should you not get anything? And then I go back to similar points to what Bernard's been mentioning, particularly in the context of the variant. We do need the second dose to protect us.
Absolutely.
Can I just come in on that, if I may? Because this is a really important one, because it's the question I get quite frequently as well, Vicky. And I think it's reminding people that the clots risk, although extremely rare, the vast majority, in fact, I thought it was every single clot that has been recorded has all happened after the first dose. So that's actually quite reassuring in itself. And just to put that into context, my sister is 27, I think, thereabouts, and she'd had her first dose AstraZeneca vaccine and had come to me saying, should I have the second? And it was when this clot risk was identified. And my advice was absolutely go and have your second dose. My mum was exactly the same. The advice I'm giving people is exactly the advice that my own family are following from me. So I think, again, hopefully that puts it into context and reassurance that, you know, people that I know, that I'm related to, that I love, I'm giving them the exact same advice I'm giving to other people as well.
I think it is quite important, actually, isn't it, for us to say, and I'm surprised by how often I'm asked, like I can have a really long discussion with someone around the evidence and then they like, have you had the vaccine? And it's like, I'm surprised that you think I'd say no after all I've told you about it. I mean, as it happened, I got it earlier than most people of my age would because of working in a hospital. So, I mean, I might have ended up in a situation where I'd be like, no, but I want it, but I haven't been offered it yet. But actually, as it happens, you know, I think it's important to say that, you know, we've been vaccinated and, you know, we've recommended our mums and our husbands and our sisters and so on to get vaccinated, because I think it's surprisingly often that people think that we might not have got vaccinated ourselves.
Absolutely. And, you know, for the record and openness, I'm double vaccinated as well. So feeling, yeah, rather smug about that, definitely. That's great. I mean, clearly, hopefully answers the questions out there around second dosing, that actually second dose is really important, and that the evidence is showing that the immune response is much bigger after that second dose. And as you say, Bernard, with the Delta variant, that's definitely something that's really important, that it's not just going to get your first one, but actually do take up that offer of a second one. So hopefully that has answered the questions that came in on that topic. So we're near the end of the webinar now, I'm afraid. So would you believe it's nearly 1 o'clock? But I did want to ask you another question each, and then a wrap-up question as well before we finish. So first question, and Vicky, I'll come to you first with this one, because, you know, as much as you have both shown us, you know, a huge amount about all of this evidence, all of the data that's coming out, you know, you're the go-to people here to ask about what that information is and how to communicate it. But sometimes you will get asked a question that you don't know the answer to, right?
All the time. Right?
Exactly. So how do you go about that? Because the people viewing, joining the webinar today or watching the recording afterwards will often be asked questions just like us that we don't know the answers to. How do you approach that and still maintain that confidence in the person that you're speaking to?
Well, I mean, I would say that admitting when you don't know something probably helps maintain more confidence than saying something and hoping that it's right. And I mean, maybe you'll get away with that, but maybe you won't. And I guess I'm in quite a lucky position, because most of the time that I'm having conversations with people, I'm having them over Twitter, which is, you know, an asynchronous method of communication. So if someone asks me something and I don't know the answer, I've got the ability to look it up, which not all of you who might be having, you know, on the spot conversations will have. Although, you know, again, if it's something that you think you can look up quite quickly, I don't think that, you know, GPs so often do this, don't they? They're like, oh, that's a really interesting question you've asked me, I'm just going to quickly look it up. I think that's completely fine here. If it's something that you can't, you know, look up super quickly, I don't think there's anything wrong with saying, like, that's a really interesting question, I'm going to look it up for you and get back to you. And also, the more that you do this, like, so much of the stuff that I'm telling you now, as you know, as if I suddenly know everything, the only reason I know it is because people asked me and I looked up the answer and now I know. So if you go and do that, the next time someone asks you, you'll be able to say, like, oh, well, actually, I can tell you about this study that did this. So I think, you know, have no shame about not knowing everything. No one knows everything. And also be transparent when no one knows. Like, quite a lot of the time I have to say, like, well, obviously we don't know what's going to happen in 5 years' time for sure, because, you know, this hasn't been around for 5 years. But let me tell you about what we do know about the long-term effects of vaccines and how the immune system works, and that will give you an idea of what we predict will happen, and we can predict it with quite a high level of confidence. So that's kind of my approach.
Brilliant, thank you, Vicky. And Bernard, what's your...
Sorry, everything Vicky just said. So being honest when I'm not sure about something, let me go and look it up, being transparent about where you're getting that information from, and then actually sharing that resource on to people. If I have a question about fertility, pregnancy, anything, like, I go to Vicky and I look at that document. I've used that so much and I've forwarded that to so many colleagues. It's really, really helpful. But now I've got the information in my head. I don't have to look it up anymore because I've referred to it so often, like you say, Vicky. And also, I think for me, being part of the MDC group and the Team Halo group has really helped, because if there's a question I'm not sure of, I pop it in the WhatsApp group. Has anyone seen any good resources? Where do I go to find this information? Can I have a quick chat to someone about this? And you know, there'll be people who are from different disciplines and backgrounds and professions that I'm from, who are much better placed to answer specific questions. But yes, I think keeping that dialogue open, honesty and transparency really is key. But then, and I always do this, I back up what I say and I share the link to where I'm getting my information from. And I think this is important because information authenticity is going to be one thing that we can hopefully take away from all of this, is teaching people how to be able to differentiate the nonsense from the evidence-based, scientific, accurate information. And this is public engagement, hopefully long term.
Absolutely brilliant. So don't blag it, fess up, and then do your research. So that's good. Very useful advice, definitely. And then one final wrap-up question before I close the webinar. I'll come to you first, Benar, and then to you, Vicky. Of course, our audience here today are predominantly people who work in health and social care, doing an incredibly important job. But what do you think their role is, or how important their role is in answering questions around COVID vaccination and engaging with younger people, and maybe tackling some of the concerns that are out there? I mean, Benar, any words of wisdom and what our viewers can take away from today?
I think what you guys do is so important and so vital, because I'm not clinically active at the moment. I'm doing a PhD full time. I have to seek people out. I have to create resources and then share them on. I have to, organize webinars and get people to join. Whereas you guys have at your fingertips people that you can have this conversation, this dialogue with. And I think having an idea of the most common kind of concerns and arming yourself with some of the evidence around that, and just a simple approach to how to address them, how to ask them, keeping that dialogue open will just carry so much more weight than telling them, here's a website, go and have a look at that. You're much more likely to trust someone that you can have a conversation with, and that's just true for anything. So you guys are absolutely key. And so if you've come today to this webinar, that is already a huge and important step, because you're already saying, I'm in a position where I can spread the accurate information. How can I do that?
Thank you, Benar. Vicky?
Yeah, I mean, absolutely. You guys as healthcare workers are a trusted voice for the people who come and talk to you. And I have so many people get in touch with me. The reason they're getting in touch with me is they say, oh, I spoke to my GP about this, I spoke to my midwife about this, and they couldn't really give me any information. So can you give me some information? And it's just a shame that that can sometimes happen. But it's really nice that you are here today, so that when people come to you and ask you for information about, these specific things that we've discussed today, and maybe about other things that you might go away and look up, you'll be in a position to be that person who's like, here's the pros, here's the cons. Now you're empowered to make your own decision, rather than be one of those people who sort of says, oh, go away and see what you can find on the internet and make your own decision, because that's not very helpful, because there's so much on the internet. So you guys are so important, and thanks for coming along and listening to us chat for an hour, because hopefully that will help you to make even more good in your communities for your patients and the people that you work with.
Absolutely brilliant, and what a great note to end on. Thank you, Benar and Vicky. We have lots of thank yous coming in from the audience here in the chat box, and saying it's very helpful, very informative, very engaging. So thank you very much. I'm afraid we've run over time, so thank you for staying on for those few extra minutes. But I'm sure I speak for everybody who has joined the webinar this afternoon. You have been amazing. Thank you. We've squeezed you dry for all of the wisdom and the knowledge that you've got, which is great. So definitely go and have a lie down after this. But you're so inspiring as well in the work that you're doing day in, day out on social media, but also through meetings and other events and mediums. So it's been brilliant having you on this afternoon, but you're doing a wonderful job. Please do keep it up. So thank you both. And thank you to everybody who has joined this afternoon as well. It's been great having so many of you here, and we have recorded this, and we will be putting that on our website as we normally do. So please do, if you want to see it, go and have another look, or promote it to your colleagues and your networks. It's openly available, it's open and free. We're also going to be sharing the links to the resources that have been talked about during the webinar this afternoon, and so that will come your way as well, so you won't lose any of that information. So hopefully you've enjoyed this afternoon. It looks like you have from the thank yous that are coming in, but a big thank you to you all too. As Benar and Vicky have said, You're doing an amazing job, absolutely incredible. And vaccines are the only way we're going to get through this pandemic. So please do keep up the wonderful work. So thank you, Benar, again. Thank you, Vicky, again. Thanks everyone for joining. And we will see you again soon, hopefully. Take care.